Welcome everybody to our webinar today. We will be discussing implementing transformational technology to create patient and caregiver value. Our presenter is Julie Holt, and we are so excited to present to you today. First, some logistics for the meeting. Everybody will be defaulted to a microphone off, but we encourage questions based on the presentation today. So please enter questions into the chat at any time during the call today. We will open up for Q&A after Julie's presentation has concluded. All right, so just a little bit about our agenda. So I will perform the welcome and introductions. And let me introduce myself. I am Sean Townsley. I'm the marketing director here at the Morel company. And I will go through a quick sponsors message, and then we will turn this over to Julie Holt, our presenter. And so she will review implementing transformational technology. She'll give us some great background about the Christ Hospital Health Network, some challenges that Christ Hospital had initially from a back injury patient satisfaction perspective, and then some of the solutions that they began to take a look at, especially to create a safe work environment for nurses. Julie will review future goals in marketing with the Christ Hospital's investment in their most important asset, their nurses. And then we will conclude with a participant Q&A. Well, let me take this opportunity to introduce Julie Holt. She is the Chief Nursing Officer and Vice President for Patient Services at the Christ Hospital Health Network. Julie has 30 plus years of hospital healthcare leadership experience. Before she joined the Christ Hospital, she was the Vice President of Patient Care Services at Cincinnati Children's. And her experiences include so many things, including co-leading successful magnet redesignation, leading the operational excellence models for clinical operations, successful implementation of Epic EMR, and developing and implementing new care models. Julie has published several articles ranging from variable volume budgeting to central line bloodstream infection prevention. In 2022, she received the Cincinnati Business Courier Healthcare Hero Award. In 2023, she was the Greater Cincinnati YWCA Career Women of Achievement Award winner. She is from Cincinnati. She received both her BSN and MSN in nursing from the University of Cincinnati, and she is a board-certified nursing executive. A little bit about our meeting. Again, implementing transformational technology to create patient and caregiver value. Really, this is such a great story about Christ Hospital's journey in early investment in automated patient repositioning technology, and the lasting impact that it's having on the health system. From an attendee benefit standpoint, this is a great opportunity to learn from other nurse leaders, collaboration, exploring strategies and tactics that improve caregiver well-being in the practice environment, and really hearing success stories that help foster retention of bedside nurses. Real quick, we'll go into just a quick sponsors message. We are the Morel company and the Hercules patient repositioner. Here we see a Hercules system being used by a caregiver and a patient on the bed. Hercules is comprised of three components. We've got the drive unit that's sitting at the head section of the bed. We have three support surface options, and then we have our dream sheet, which is twice as long as your standard cotton sheet, replaces that sheet for one layer under the patient. Here we see the caregiver attaching the sheet to the sheet attachment strap in the drive unit. She is now clipping that sheet into the mattress along each side. There are 5 clips along each side of the mattress, and now she is guiding the sheet into the drive unit with the simple push of a button. So now to boost the patient, she is simply pressing 2 buttons on the side of the drive unit Obviously, this is a very safe, comfortable experience for the patient and the caregiver. There's no lifting, there's no tugging, no pulling, very comfortable, just a better overall patient experience. You notice the head of the bed is raised, the sheets are on the patient, maintains their dignity. To change the sheet, we're simply releasing it from the sheet clips. We're pressing the sheet release button, and we are pulling the sheet out of the drive unit, releasing it from the sheet strap, and placing that into soiled laundry. Hercules fits on virtually any existing hospital bed and hospital beds in your facility, and we can safely boost patients up to 750 pounds. We all know that the nursing shortage has required us to do more with less. And so with Hercules, we're able to really provide that efficiency to replace this high burden, low value task of manually boosting a patient up in bed, replacing that with an efficiency through automation with the Hercules Patient Repositioner. Our impact includes improving nursing retention, eliminating 100% the chance of a boosting injury while using Hercules. We're saving an hour per nurse per day. We're also able to reduce the infection exposure by more than 50%, simply sending fewer people into those contact isolation hospital rooms. And we're having an impact by decreasing hospital-acquired pressure injuries, and then again, just that overall improvement in the patient experience. From an efficiency standpoint, typically bedside caregivers are boosting 11 times during a shift. This is based on survey data going back to 2012, where we've seen nearly 5,000 responses. And so if you look at manual boosting, again, on average, this is taking 7 minutes per shift. And why is this taking 7 minutes per shift? Because it takes time to find help. It takes time to find equipment, to adjust the bed height, to adjust the feeding tube, to potentially lower the head of the bed, place the bed maybe in Trendelenburg, and then we've got to undo everything that we just did. And so if you take this 7 minutes per boost over the course of 11 times per shift, this is 77 minutes that we're spending on this low value, high burden task of manually boosting a patient. With Hercules, we're able to reduce this to 10 seconds per boost. We're pressing 2 buttons on the side of a drive unit. Same amount of times per shift is 2 minutes per shift. And so what can we do with this time that we're giving back to the caregiver, saving over 1 hour per caregiver for each shift. So this is time that we can spend on direct patient care, on charting. We can actually clock out and take a lunch when we have Hercules as part of the mix. We can do self-care, and we can allow our staff to leave their shifts on time, avoiding that overtime. And so from a caregiver and patient experience, we're improving comfort, we're protecting dignity, we're seeing quicker response times. Every time the nurse enters the patient room, she can boost the patient up in bed. We're seeing an improvement in HCAHPS and Press Ganey scores. It's less pain for the patient, and it's just a better overall clinical outcome that's coming in as a result of keeping that patient in that up in bed, safe position. But enough about Hercules. We are here to hear from Julie Holt, the Chief Nursing Officer and Vice President of the Christ Hospital Health Network, to talk about implementing transformational technology to create patient and caregiver value. Julie, welcome to the webinar. So glad to have you on today.
Thank you, Sean. I'm really excited to be here and tell our story from the Christ Hospital. Just a little bit about me. I am absolutely an RN, and really that has stuck with me through all of my journey and my career. But my clinical background is in neurosurgery, neurology, and neurotrauma. And I remember back, being a staff nurse in the 90s and having bed vendors come in and ask us, like, what would be helpful for us. And in neuro, we had hemiplegic, semiplegic, quadriplegic patients. And we always would joke around, gee, it'd be great if you could, figure out how to keep a patient up in bed. and really, I have to say that I never thought that we would be able to come up with a way to do that. And so I've been a chief nursing officer now for almost 20 years, and I've been at the Christ Hospital for 9 years. And about 10 years ago, the Christ Hospital partnered with Morel and Bill Hildebrand, the CEO, to bring this technology to the Christ Hospital. You can go to the next slide, Sean, if you want to. And I have to admit, when I first walked through the doors of the Christ Hospital, I was a bit skeptical about what this mattress and what this technology could do. But when I saw it and I talked to the nurses and the patients who were using it, I have to say that this is probably the most transformational piece of technology at the bedside, from the way that we actually get the work done, that I have ever seen. And so I think it's really just that impactful. And it's really aligned with, our vision and mission at the Christ Hospital to provide, be a national leader in clinical excellence and patient experience. And the way that we know we can do that is through our secret sauce, which is our frontline nursing staff. And so a little bit more about the Christ Hospital, if you want to go to the next slide, Sean. We were founded in 1889, so we've been here in Cincinnati, Ohio. We're actually in downtown Cincinnati, but we do have satellite locations throughout the region. We have about 6,500 employees. About 2,000 of those report up through me, and we have about 1,600 RNs in the organization. Here at the main campus, which is the picture that you can see both in my background and on the slide, is a 555-bed campus with an average daily census of somewhere probably around 360 to 400. We specialize in cardiovascular care and several other service lines. And I'm really happy to say that we've been ranked for the last several years in Cincinnati through U.S. News and World Reports as the #1 hospital in our region. So we're small, but I think we have a really significant impact. And I think it's because we have a CEO who is a nurse and a CEO who has always embraced this technology. And she's actually the person who brought the Morel mattress here to the Christ Hospital Health Network like the year before I came on board. And then I would say the last thing that we are really, really proud of is that we are a magnet hospital, which will come to play in a couple future slides here. We are getting ready to go into our 4th redesignation. We've been a magnet hospital since 2010. So we can go to the next slide. So back in 2015, which was right around when I was joining, probably about 6 months before, we recognized that we were seeing some increases in back injuries within the organization. And this was under Debbie's watch. My current CEO was the chief nursing officer and then the chief operating officer. Excuse me. And so she knew Bill Hildebrand at the time, and she started to search for some solutions. And we had already invested, as I'm sure many of you have, in all the lifts and the positioning equipment. I think that every hospital across America has. So we had all that, but we were still seeing injuries. And as a bedside nurse, in the past, I know that part of that is because you got to find all that stuff to make it actually work. And it takes time and effort. And the minutes that Sean referred to early can multiply quickly if you're really busy and you can't find people to help you, or you can't find the equipment you need, which is never an issue with the Hercules device. But so we started seeing more back injuries. And in particular, we had one unit that really saw an increase, as you can see, over 2 years. So Debbie, started looking for options. Next slide. So she worked with Bill, and they decided that they were going to trial the mattresses We call them mattresses. It's more than a mattress, definitely, on our 26-bed renal kidney transplant unit. We had a very engaged manager there who was super excited about it. And I believe, I may be wrong, but I think we were the very first hospital to implement the device in a large area. I think other people may have trialed it, but and so immediately after the purchase, I can't tell you, that's about when I came on. I think they had just received the mattresses and started using them. The amount of positive feedback from the nurses was just overwhelming. And like I said, I was a little bit skeptical, like, wow, going back to my neuro days, is there really something that you can just hit a button and pull a patient up in the bed? Yes, there is. I went up to look at it and I was like, wow, it really does work. It's amazing. And the nurses were crazy about it. We did see immediately after implementing on that particular unit a decrease in our position-related injuries. But I think even more impactful when I talk to nurses throughout the hospital and the units that have these, and I'll tell a story later, but people, like, maybe they don't have a documented injury, but they go home with more energy. They go home without feeling sore. And I think that's a huge thing for people to be able to leave work feeling as energized as they were when they came in. And I think it really makes a difference from that perspective. And then the patients really liked it as well. I didn't get as much feedback from the patients, but the patients that we did talk to, we actually did a study, and I'm going to talk about that in a minute. It was really very positive. So next slide. So as a magnet hospital, we decided that we wanted to, get some data around this. And we went to the IRB, in our internal IRB, and put this proposal forward. And it was to basically just assess and compare patient and caregiver perceptions of safety, efficiency, and satisfaction using the Hercules patient repositioner versus a control group of in a similar care area where the mattresses were not available. We had a 14 questions on a questionnaire, and for administrative rounding with the patients, and then we had a 29 question document for RNs, and we also surveyed our patient care assistants who assist the RNs on the unit. And we had lots of participation, as you can see. We did the staff on the unit, but then we had other people who would float in or share into the unit, and we surveyed them as well. Next slide. And this is what really we found, that they felt like 97% agreed that it was safer and that they were less likely to be injured with the Hercules device. 97% strongly agreed that their patients were cared for in a more timely manner because you didn't have to wait to find 2 or 3 other people on the unit who could stop and help you move a patient. 100% agreed or strongly agreed that they saved time when repositioning their patients, and 100% were very satisfied with Hercules and would recommend its purchase. And it was one of those things, like, I think as a nurse leader, I'm sure many people on the call, know that we roll out technology and things, and people at times can be resistant. This is one of those things where people are like going, hey, when are we getting those? When are we getting those? And you can't spread it fast enough. Next slide. From a patient perspective, 94% said that they felt like Hercules was safer from a moving perspective, that they felt more secure when they were being moved. They agreed or strongly agreed that they were moved more quickly. And they were very satisfied, 94%, and 98% would recommend it versus traditional boosting. And when you think of the unit that we implemented this on first, it is a renal and kidney transplant unit. And most of those patients are regular patients. They're unfortunately in and out of the hospital a lot. So they have a lot of comparison of what it was like to be moved without the device. So we can move forward. Next slide. So what we found, and we ended up presenting this, we did both the poster and we actually did a podium presentation at Magnet that year. We found that Hercules is perceived as safer and more efficient method of boosting patients, and that it's more desirable than manual boosting. And overall, people were extremely satisfied with it. And we knew at that point that we had the qualitative, quantitative data to really expand the project throughout the hospital. Next slide. This is, I think we'll probably, when we send this out or we send out the slides, this is our actual poster presentation. So if you're interested in more of the questions and the data, you can get all that information off of this particular slide. Next. Oh, one other thing about that is we did have our magnet survey that fall, and it was my first magnet survey at the Christ Hospital. And we actually had this as one of our sources of evidence as well for our document, and our surveyors asked us about it. And I have to admit, they were also very skeptical, much like I was when I first heard about the technology. They were like, really? Can it really do that? And so we marched them right up there to 2 South, and they saw it for themselves, and they were super impressed and really excited about that for nursing and for the patients, but really transformational for the way that nurses provide care. So next slide. This is just a little bit of a timeline. I would love to have these devices on every single bed in our organization, and that is our goal. We have a significant plan on getting there. It's like a bed replacement, mattress replacement plan. So we do plan to do that. But this is kind of the timeline of how we've rolled out. And we now have the technology on about 140 of our active 400 beds. So all of our ICUs are live, and that's extremely helpful. I do want to add that in our CVICU, we use a lot of devices. We do transplant. We're a quaternary care center. We've started our transplant program about 1.5 years ago, heart transplant and kidney transplant. We've been doing kidney transplants for a long time. We've done 29 heart transplants in the last 1.5 years, and that unit uses these mattresses. And so some of these patients, not so much the transplants, but the people who are on the devices prior to the transplants, it's really, really hard to move them safely. But the mattress is, and the device makes it easier for the nurses to do it safely when they're plugged into all kinds of things. So it works. Next slide. So, as when Sean asked me to talk about our study and our journey, I asked my team, like, hey, we haven't looked at this for a while. What's going on with our patient experience scores as they compare between our areas that currently do not have the mattresses and the devices and the units that do? And when we looked at it, it just reinforced kind of what our perception was. Our patient experience, I do want to start off by saying that our overall patient experience in our organization is very high compared to the national average. We run probably between the 90th and the 95th percentile for likelihood to recommend. So we start off high everywhere. But our scores on the units that have the device are higher. And our MICU, without the MICU, they're even higher. The MICU has very few discharges, as you can imagine, from an ICU. And so they had a very small sample size that had a little bit of a lower score that sort of skewed that. But overall, a 3 to 6% improvement. Sorry, Sean. Yeah. Sure. As far as patient experience, we were the original site, as documented in this slide. And I think there's like kind of a fun, or not fun, but a really great story. When we switched out the beds, like when we were changing them, actually taking patients who are on the old mattresses without the device and then putting them onto the new device. We had a patient who was a frequent flyer, who was rather large, and she was telling our staff, and I think maybe Bill was there as well, that this was like so remarkable for her, because if you're a patient that's larger and you're unable to move, people like to be able to take care of themselves. And she said that it improved her dignity. She felt like before, that 4 people had to come into the room to move her up in bed. And she felt like she was taking all those people away from the work that they were doing and from other patients, and that it was just embarrassing to her to have to do that. And with the device, she didn't have to have that experience anymore. And she actually started crying because it was so transformational for her. And so I love to tell people that story because it really made an impact on me. Next slide. Okay, so what does this all mean for nursing? It means a lot. From an attrition standpoint and turnover, we are seeing our turnover go down overall since the pandemic. And we are fortunate enough to have an attrition rate that is lower than our community average in Cincinnati. So that's great overall. But you can see that on our units that have the Hercules device, our turnover is lower than the other units. And so that's a pretty big range. It's a 59% lower attrition rate. I was really excited when I saw this because I recognized that I'm probably not using or touting the attributes of this device enough when I'm trying to recruit and retain nurses. But I do have anecdotal stories of nurses who have left for whatever reason and come back and talk about the impact that these mattresses make on their day-to-day work. And I think that that's pretty important. And we do know now that many hospitals in our region have gone to the device. So we're not the first ones anymore or the only ones, but it does definitely make a difference. The other thing that I just wanted to mention is I had a nurse tell a story to me in our CVICU. She said that one day she went home from work and she was talking to her husband, and she's like, my shoulder doesn't hurt anymore. And her husband's like, what do you mean your shoulder doesn't hurt anymore? Your shoulder's been hurting you for 20 years. And she's like, she's about my age, and she was like, I know it has, but I just noticed that it hasn't been hurting me. And they sat there and they tried to think about, like, why would her shoulder after 20 years of aching not be aching anymore? And she really attributes it to these mattresses and this device. So I love telling that story because it was so heartfelt when she told it, and something that you just hear from people. Like, I'm just not as tired. I just don't ache. Maybe I didn't have a formal injury, but I'm just in a better spot when I leave work after using these devices. Next slide. So this is just sort of a visual of that kind of phenomenon. We went from having 2 people up to 4 people to boost some of our larger patients, to a unit who did a little video after they got them. I think that's our oncology unit was super excited after they got them. They actually put like a nurse in the bed and drove it around the unit and did a video because they were thrilled. And we actually paid for the mattresses on the oncology unit using a foundational fund and grant that we had received for oncology. And so that picture is them saying thank you to the foundation for bringing them the devices. Next slide. So, like I said, I asked my team to pull some data on what's going on now as far as our injury rates. Like, our injury rates have declined over the years in general to being very low. So we're very, very fortunate that we have very few work-related injuries as far as the nurses are concerned. We wanted to look and see if we had any patient repositioning issues. I did not have a chance to go back and actually dive into the specifics here, but I think what's important to say is that although we have 0 on many, many units and just 1 in each column, the actual rate of injury is lower. There are more units that have the device and more beds, more nurses affected on the right side, and they only had 1 injury as compared to our other units. So, but like I said, we're very lucky to have low injury rates to begin with. So, next slide. So how, I mentioned just before, how have we done this? We have our bed plan and our mattress replacement plan. So we definitely have purchased several of these devices through our capital, knowing that there's a return on investment in both patient experience and in nurse retention and satisfaction and the reduction of injuries. So that's the return on the investment from a capital perspective. But we also got creative to try to move some of this faster. We 1 year we do an I Give campaign where employees can donate to the hospital, United Way or ArtsWave, and the fund was for additional Hercules mattresses, and so we were able to actually raise enough money in that one campaign to put the new device, the Hercules devices in our MICU. So that was great. And then, like I said, we do some big campaigns around different service lines. Each year we focus on a different service line. And when those dollars come in, my boss down there in the corner, Debbie, is always willing to reinvest back into the nurses. And so that's one way that we've been able to keep our plan moving along. Like I said, my goal is to have them on every bed within the organization. And just another shout out to my boss as a nurse and a CEO, and someone who values innovation and transformation. I can't thank her enough for introducing these things to our organization and really proving the concept for really the whole country and the Morel company. So it's great. Next slide. So future goals, like I said, mattress on every single bed, making sure that we align and put aside enough capital to do what we need to do to make that happen. And then after looking at my recent data around attrition rates, my next step as well is to use or to at least get out there and spread the word to people we're trying to recruit that we have these devices and that this can make a big difference. We do usually have potential nurses and PCAs shadow first before we offer positions. And so they do get to see the mattresses and the devices work when they do that. But I think there's more that we could do to really, make this something that, not make it because it already is, but to get the word out there that this is something that can be really transformational for nurses, individuals as caregivers. Next slide. I think that's it. I would love to have questions, happy to answer anything.
Thank you so much, Julie, for that presentation. If you do have a question, please, you can type that into either the chat or the Q&A function that is part of the meeting system. And so we'll take a look into the chat and the Q&A to see what kind of questions we have.
Looks like we have one already about CNO buy-in. So I would say that, first of all, the first and best thing to do is to get people in front of the technology and let people see how it actually works. Having someone, I can't tell you over the administrators and board members, donors in the bed, hitting the button to show them what the experience is, both from a patient and from a nurse. I think that that's the first thing. Once you see how it works, it's pretty hard to deny the value of it. But as we all know, you have to be able to prioritize and fund the purchase of this type of equipment. So I think the second piece is the ROI piece. And it's tough sometimes because some of the things that I just shared, like attrition and patient experience and injury rates, are all affected by many, many different things, not just one, silver bullet. But I think looking at those things and sharing some of the information that I shared today, setting up a study, asking to do a pilot, can we do 1 unit? Can we measure these things and see if they improve? My thought is they will, and that will show the return on investment. I think the national statistics are that is conservatively, if you lose one nurse, it's $52,000. If you have an injury, I don't know what it is anymore for medical leave and those types of things, but those dollars add up really fast for your return on investment. Hope that answers that.
Yeah, it looks like we have a couple of other questions. One, what if our hospital has already bought new mattresses? And I can probably add some clarity to this. There are multiple options when you're considering Hercules. One of those options is what is called an upgrade, which is simply taking the outer cover on your existing mattress, especially if those mattresses have technology and life left in them, right? You may not want to entertain the idea of going through a complete purchase of new mattresses. We can simply take our outer cover and replace your existing mattresses outer cover. And that allows us to incorporate the clips that are along the side so that we can integrate with our sheet. And so it's a simple process and certainly an option that you can consider. Okay, we have another question in the chat. So thank you for the great presentation. The data for nurses and patient clinical impact are so impactful. If you're able to speak to what has worked well for you and your team in engaging financial decision makers in the project to make the initial investment in the technology while also supporting the ongoing expansion, i.e. the most important factors or criteria to meet to justify the purchase.
Yeah, I think, I'm not going to underestimate how fortunate I think we are at the Christ Hospital to have had a chief nursing officer prior to me who was able to bring that in. And now she's my CEO because she really just understands the value. I don't have to, I feel very fortunate. I don't have to prove it to her. But the initial study that we did on 2 South was enough for her and our CEO at the time, who happened to be a banker, and our CFO to agree to go ahead and just put that in the plan as we replace. So I think that the most impactful thing would be to just get out there and find out what is your attrition rate and what could you do if you save a nurse or you save a back injury. It makes a huge difference. And like I said, our patient experience is really high for lots of reasons, but I am sure that these mattresses do have something to do with it. I mean, I think they're hard. I agree that it's a softer ROI when you're talking to CFOs, but it is there. So I don't know that I'm helping, but I'm very lucky to have a nurse as a CEO. So she really gets it.
Okay, we have a question. This is a follow-up question from Michelle, who asked originally how she could get CNO buy-in. She says she's been turned down year after year, even to do a trial with Hercules.
Yeah, I would say don't ever give up. I've been a CNO, like I said, for 20 years in like 3 different organizations. And I've put the same thing in the capital request year after year for many, many years before I get it. So I would say keep trying. And, I'm happy to have people reach out to me. Sean has all of our data. We can share that with you if it helps in any way. I'm happy to talk to people about what our experience has been. But don't give up. It's worth it.
Michelle says, thanks for the support. And Michelle, we are happy to reach out to you to connect as well, to look at creative ways to help get this in front of the right people, to move forward with a trial. All right, we have another question. Wonderful presentation, Julie. Is Christ Hospital part of an IDN or is it a standalone facility?
We are independent. So we have some other facilities, but we are not part of a larger network. It's our base hospital. We have an independent board, and we have not partnered with other systems to this point. So I'm not sure I know what they mean, what Kathy means by an IDN. I'm drawing a blank on that abbreviation. So hopefully I answered that question, but
I think so. Yep.
Yeah.
Okay, we'll look real quick for any other questions. If anybody has a question, please type in now so that we can get to that. We'll just give it a minute or so. Not seeing anything else come through. Again, thank you, Julie.
Sean, can I just say one other thing?
Please.
And maybe this is obvious and maybe people are already doing this, but don't underestimate the impact of having people actually, like, if you don't have any of these in your facility, like actually trying the technology. Like I said, I think people have in their heads like, hey, capital's tight, this can't be that impactful. And like when Sean shared the amount of time that people save, I think some of that data actually came from us. It's huge. And I also had some people who, like, once we had the first unit going, I actually took people by the hand and took them up to 2 South, and I'm like, you've got to see this. Just come here and look at it. So you need the data. Don't get me wrong. I'm a very data-driven person, but don't underestimate what someone actually seeing what we're talking about can do for people to believe it. And I'm not talking about the video. I'm talking about like actually sitting in the bed and seeing what it's like. So sorry, Sean. Just had to say that.
No, thank you so much. And Julie, thank you for spending your time with us this afternoon, sharing your story and experience at the Christ Hospital. It's very impactful. For everybody on the call, we did record the call. We will be posting the recording to our YouTube channel, as well as to our social media channel through LinkedIn. And so you will have access to this presentation post-call. We will also follow up based on the email address that you registered with, to ask you to complete a post-meeting survey. Your feedback helps us identify future presenters, so that we can continue to put compelling information in front of you. We thank you for your participation today. Please reach out to your Hercules representative if you have any questions or to schedule a demonstration at your facility or virtually. Thank you, everybody.